Dr. Lee, welcome to Podcastina.
Thank you for having me.
Thank you so much for doing the show. Can we start with a little bit of background about you and what you do?
Absolutely. I'm located here in Nashville, Tennessee, and my background is that I'm board certified as a general surgeon, and so my initial training coming out of residency or coming out of medical school was in surgery, and I did that for a number of years after I graduated residency in 2010. What happened was is right after graduating residency, I started to notice that my body really wasn't cooperating with me the way I wanted it to, and I also recognized that if I were to go over to doctors that were traditionally trained like myself, I knew what the answers I were going to get about what was, why is a 36, 37-year-old guy having ED, and why is he having trouble sleeping, and why does he have a poor workout recovery? I mean, all signs that something in the male body is going wrong. And so once I realized that there was no real good place for me to go get that advice, I took it upon myself to create a system, a business, a platform that would allow people to not only kind of get through that transition of what we call andropause or menopause, but also have legs to work with these clients over a few decades or a couple of decades to help them age well, right? So it's about optimizing our years here on this earth and our productivity so that we can be present for our family, be present for our life's mission. And we really try to work with our clients over a long frame of time, because the orchestration of longevity, is not immediate. It's an orchestrated, thought out process. And so that's what Compass Human Performance does. So now I dedicate my time 100% to anti-aging and performance and longevity. I'm married to my wife of 21 plus years. We have 4 children. I like to cook, and I enjoy being outdoors, and I enjoy learning about there's so much exciting stuff, coming on in the anti-aging world. And so it's a really exciting time to be a longevity physician right now.
Yeah, there's so much to that world that I think not only because maybe sometimes when people hear longevity, they may kind of take it to mean, a superficial existence of we don't want to age, we want to stay frozen in time, we want to look the same. But it really is a matter of the big picture and your overall health because all these longevity things that you're doing, they're not just for looking good into old age, they're for functionality and for making sure that you maintain your ability to walk and lift things and, just be able to maintain lifestyle as much as possible.
Yeah, functional lifestyle, right? One of the things that happens as we get older is if you move into a period as an older person of social isolation, your decline becomes very rapid. Social isolation, we know, is a key factor, or a negative factor for aging and cognition. That social connection is just so important for us. So you're right. The superficial part is really not that important. It's all the underlying stuff that make the difference. It's like an iceberg. You see the little bit of top, but all the work is down below.
You said a word that I hadn't heard before right before menopause. What was it?
Andropause,
What
right?
is
So think
that?
about men. It's when men go through this, right? When
Oh,
we start to lose testosterone. So it's just the male, the androgen equivalent of losing our hormones, just like women. And it starts, women actually start menopause, if you will, in perimenopause, which is like late 30s, early 40s kind of thing. And that's when men start. I mean, that's what happened to me. I was 35. I'm like, God, man, I feel terrible. Like I have a great relationship with my wife, yet from a standpoint, we had little kids too, so things were difficult there. But when you realize that you don't have the desire for intimacy to be with your partner, you're like, okay, that's not normal. And I certainly didn't want to rest on that, and so I knew it was telling me that something underlying all this was going on.
okay, that's incredible. That's like a huge takeaway for me already because I don't really hear that word thrown around as much as you hear about menopause and perimenopause. And I don't know if that's because I'm in a bubble of just women's issues or because men in general or society in general doesn't really talk about it. What are some of the other red flags that kind of indicate that that's happening with men?
Well, I would say that first of all, your assessment of the two things you just said, they're both correct.
Mm,
So one video that I put out or have recorded on Instagram, I don't know that it's been released yet, but I said the same thing. I'm like, look, I know a few weeks ago we had this big meeting at the White House, a lot of attention on female hormones, and I'm like, but look, and all these ladies, rightfully so. I'm not trying to take away the fact that they kind of got the short end of the stick, but so did every one of their husbands. Nobody's cared about them. You know what I mean? Like nobody's tried to get us testosterone. And so guys got screwed just like the women did by being told you don't need hormones and all this stuff. So society has gone against it. And yes, there has been, and rightfully so, women most of the time, in my experience, drive the development of healthcare. Right. In other words, if you ask me who my ideal client to receive is, I'm looking for a 35 to 45-year-old female because they're going through a transition. They are more likely to take action. Guys just don't take action to solve our problems, right? And women typically direct the healthcare for the family. They look out for their children. They look out for their husband, right? And it's kind of they're the orchestrator of that. And so society's done it. Men don't speak up. It's a whole combination of things. But what are some of the other signs you were mentioning? So let's kind of take it. I think do it sex specific. Let's do women first. Um, my experience has been that women will have a combination of these following three symptoms or four symptoms. Poor sleep is going to be a big one. Moodiness, I don't, you can describe that as depression. You can describe it as anxiety. The blue feeling, sometimes feeling sad, lack of motivation. So we can kind of, translate that in different ways, but um, moodiness or changes in your mood overall are very prominent for women. And it can be very specific throughout certain parts of their menstrual cycle, or it can be more sort of spread out. And what I notice that's the most common pattern is that women will start to have more moodiness and start to feel off right in the 10 days or so, 7 days before their menstrual cycle starts. And when that happens, when I get that lead in from a female, I know I'm on to a significant hormone imbalance. Another one would be weight gain, specifically like around the middle of the belly, or the lower abdomen, where you start to see like that little lower pooch. Um, Lack of libido would be number three. And I think we did sleep first, right? So, and then number four would be that sometimes we start to see menstrual irregularities, heavier bleeding, where the cycle becomes very heavy in the first day or so of it. I have women all the time who have to stay home for a day or so in their menstrual cycle because their bleeding is just so heavy. They
mhm.
can't leave the house. And so I would say those would be the four, things I look for. There's some lesser ones that are out there, that you start to think about, but those can oftentimes be confused or conflated with other things. And in men, actually, Galena, it's very similar, right? So we see like changes in libido, hard to recover from a workout. So they gain weight, they don't go work out as easy, they have low motivation. They will oftentimes have disrupted sleep patterns, just like women. And so the symptoms of male and female hormone imbalance that start kind of in that mid to late 30s are very similar.
And the primary cause is a shift in hormones or lack of hormones, or what's happening there?
Um, yeah, I would mischaracterize it more of an imbalance, right? Especially in women, because of the way that women's hormones are. You have women have testosterone that kind of does a certain set of biological functions, and then they have estrogen and progesterone, which perform a separate set of biological functions. And there's some overlap between these two, but largely speaking, when I'm talking to a client, I'm trying to separate out testosterone from estrogen and progesterone. The hallmark of perimenopause, or the sort of initial hormone changes that associate with perimenopause, are the loss of progesterone and the loss of testosterone. So, kind of clinically speaking, the two hormones that are most likely to be off and resulting in those symptoms that we just discussed are going to be testosterone and progesterone. And shockingly, to most people, most clients, those numbers are normal on an exam or on a lab panel. You're going to look at it and say, "Oh, yes, not that far off," right? But it's not, and it's the same thing with men. Their testosterone may be 400, but they've got the symptoms. And the interesting thing is when you replace their hormones, when you get their testosterone up to 1,000, or you get their progesterone to 18 or 20. Now their menstrual cycles go smoothly. They don't have these front loaded heavy cycles. They start to get better sleep, which helps them recover better. So they get restful, deep sleep at night, which makes it less likely that they're going to hold on to that weight from the cortisol abnormalities and the stress that are going through these hormone changes. Um, and so, yeah, I think that these Yeah, I mean, from the standpoint of how females develop, think about estrogen and progesterone as being in one bucket, testosterone being in another, and testosterone and progesterone are going to be the hallmarks in that perimenopause period. And then estrogen will go, whatever, 8 to 10 years later, and that's when hot flashes, vaginal dryness, hair, dry skin, all of those secondary effects come on. So for females, this is a 15-year transition for a lot of women, right? And it there's just not a lot of recognition of that. And for men, it's more of a kind of shut the switch off. You know what I mean? Yes, there is a gradual decline of testosterone over time, but we reach a kind of critical mass where probably somewhere in the late 30s, early 40s, our testosterone doesn't at 500 or 450 or 600, which are totally normal numbers, won't match the biological activity that we need it to, right? So think about this. Might your car perform better if your car was 2 inches closer to the ground? Let's think like a racing guy for a moment,
Hmm.
right? And so my point is that that small amount of distance can make a huge impact in the performance, right? And it's the same with our labs. Just because they're normal on some arbitrary scale, and I do believe most of these are kind of like population norms are arbitrary, right? We're just sort of selecting out top and bottom guidelines. But the reality is just like that race car will perform better when it's at a specific height in relationship to the track surface, so the human body will perform better when the hormones are regulated and at a preferred level, which is biologically optimal. And so that decline occurs at different points, for different people. But um, yeah, I think that the decline is kind of inevitable. I noticed that there are things that accelerate the decline. If a woman, and a classic example was my wife, so she had our fourth child at 38, and within a couple or 3 months or so of her last delivery, she was catapulted into what we called, postpartum depression, and those mood disturbances and those you know things that she was feeling persisted. And it was only after a year of us kind of working to figure out what was going on that we really started to say, okay, this is a hormone imbalance. Things had started to get better for her. Her body came back. But a pregnancy late, and late can be a variable term for a lot of women, right? Like nowadays we have women who are in their 40s having babies regularly.
Hmm.
So, but what I've seen is that women who have babies later will oftentimes have an accelerated course to perimenopause.
Wow.
Give me guys who've been through stressful situations, who've lived like in the military or something, where they've had maybe they got really sick and they were hospitalized. That will accelerate hormone decline also.
Okay, that was going to be my next question. If there's similar events that may happen to men that accelerated in a certain way, I also am led to the question, how much is a significant portion of a woman's life spent on birth control impacting this? Because I myself, after I don't know why I'm getting this personal on the podcast, but whatever, it's relevant. Maybe someone will learn something. I had been on birth control, hormonal birth control, for probably 15 years and then got off of it a year and a half ago, almost 2 years ago. And not only did my period drastically change, but I also noticed like a drop in what I thought was just baseline anxiety.
Yeah, there's been a lot of reports came out, over the last like 2 to 3 years or so about how long-term oral contraceptive use can affect not only I believe it affects risk for things like breast cancer, ovarian, and uterine cancer because of the synthetic hormone use.
Right.
But we know that it can contribute to things like depression, 10, 15 years later. I think I had a post on this like a couple months ago about how oral contraceptive use prior to the age of 20 was linked with like depression in your 30s. And don't quote me on that because like it's all on my Instagram page. But yes, you're right. There are a lot of downstream consequences to oral contraceptive use. We can talk about how it affects your choice of a mate. That's been proven. A woman on birth control is more likely to choose a man that is similar to her rather than opposite of her. Um, and and for what it's worth, to get personal a little bit, when my wife and I first started dating, she was not on oral contraceptives. And I can tell you honestly that we are very opposite in terms of our skill set, in terms of kind of just a lot of things that are sort of not fundamental fabrics to the relationship, but things about our personalities, maybe, or about how we approach things. We're very opposite. And so when you hear that data, like, okay, women tend to choose a man like them if they're on hormones, and then you have your own personal example, which shows the opposite of that, it sort of starts to make sense.
It definitely does, and not to go completely like off topic because I wasn't anticipating talking about this, but it is endlessly fascinating because I have followed those stories that come out about impacts like in taste, in reproductive taste, when you are on birth control and you're not. And I have this joke about how I'm like, oh, is that why Timothy Chalamet is so popular? Because he's more like kind of effeminate looking, and I'm like, is that part of it, that a woman who spent a really long time on hormonal birth control might be more into like a quote unquote feminine man? But I don't know how true that is. That might just be like a funny headline.
Well, I think it'd be worth looking into, from a societal standpoint, what shift does occur in a woman's preference based off of that.
Yeah, it's so fascinating. So, with men and this rapid decline that could happen, this kind of sharp perimenopause ish, equivalent fall off that happens, that's from trauma and stress and enduring just a hard life. I wonder how much societal circumstances now are causing that to happen, because there's so much less conversation around what's going on reproductively with men as they age. It's always about, oh, go get your eggs frozen and go do this. And people just don't talk about like the fall off in the quality of sperm as men age as much.
That's very true, and so when we while we hit some of those big factors that can contribute to that hormone decline, there's a lot of things that we don't talk about: EMF waves, plastics, microplastics, endocrine disrupting chemicals, and things like soap, shampoos, and deodorants that have been around for a long time, like phthalates and parabens. So I believe that there are a lot of environmental factors that contribute to this hormone decline because we are seeing the hormone decline earlier, right? In other words,
Mm,
if you go back 25 or so years ago, we didn't see as many young men with low testosterone as we do now. So I think it's food related, environmental related. Um, and so, here's the reason why I think there's less sort of attention to the male aspect of this. You know, um, First of all, Viagra was a very big thing for male sexuality. And most men, unfortunately, as long as they can still achieve an erection that's suitable for intercourse, they look at their body as being fine. And that is the
mm,
only measuring stick that they need to know that they can still live life because intimacy is so important to males, right? And so, as long as they can still check that box, to them, I'm cool. And so with the use of these, medications that can maintain sexual function despite having organic disease or real medical problems like low testosterone, for example. So if we get a phone call from a male client that says, I'm suffering from ED, our first thing is not, oh, let's get you on a prescription for Viagra. It is, let's check your hormones
hmm
because I can give you all the Viagra in the world, which may help you temporarily, but I want you to still be able to maintain an erection 30 years from now. And the way to be able to do that is going to be to address the underlying cause of this right now, which is usually testosterone. And the other part of this is that it only takes one sperm, to kind of have a conception, right? So in men, even as we age, when we're young men in our early 20s or whatever, we may through each ejaculation put out 4 to 500 million sperm, in one ejaculate. But as we age, that number may go down. Let's say it even goes down by 75%. So now you're down to 100 million sperm by the time you're 60 years of age, but it only takes one. So there's not a lot of concern about males being able to conceive. Now that's a volume thing, meaning we're just putting enough sperm into the environment to fertilize the egg, but the quality, I believe, also has something to do with it. Now what's interesting to me about this is that we oftentimes, and this has come about with Maha and RFK and his kind of pledge to talk about autism and bring some of the knowledge around autism to the forefront. And he was famous for saying, like, we're going to know the cause of autism by September. And I put a little clip out and I said, yeah, don't go so fast there, cowboy, because you're implying that there's one cause for autism. And nobody, including myself who treats autistic kids, believes that there's one cause, right? Like it is a compilation of things that ultimately lead to that outcome. And and so when we look at this, it's the same thing for our hormone decline. It's that multifactorial, everything from soap, shampoos, and deodorants. And it's the same thing that are happening to these kids. It's not one thing. And so in male fertility, or in autism, rather, sorry, when we look at autism, we blame the kid. We're like, what happened to this kid? Well, what about the quality of the parents? What about the
Mhm.
quality of the sperm? What about the quality of the environment that this baby was nurtured in inside the mother's womb for 9 months? What did she come to the table with? Was she on birth control for 20 years? Did she drink a lot? Did she have a past history of smoking? Was she not exercising? Like there's a lot of factors that mom and dad can have that can influence that kid. And we're blaming what happened, we're blaming the product in front of us, but we're not looking at us.
That's such a good point. Thank you for highlighting that because I have also seen, and I didn't dive too deep into this because my understanding is just very surface level, but that especially with a much older father and the mother too, right? It's like you need both environments, but that could be a driving factor, not just of autism, but of other issues, including a woman having a difficult pregnancy because the male is maybe unhealthy or overweight or has alcohol and drug history, that deteriorates the sperm to the point where she's just going to have a tough pregnancy regardless.
Yeah, I think those factors are all valid concerns.
So, would something like hormone replacement be a good idea for most people, all people, some people? What are the kind of determining factors for when it's time to consider that?
I think there's, from my perspective and the way I practice here at our clinic, we would look at this for three predominant aspects, right? So, number one, what is your desired outcome? What are you looking to achieve? Where do you want your body to be in 5, 8, 10 years from now? And does hormone replacement therapy play a pivotal role in you achieving that outcome? Okay. Number two would be is if the hormone disruption, and this is most common for women, but I mean on the ED side, it affects men, right? So for a male, losing erectile function is a big trigger to seek help. And then for females, when they are no longer able to sleep through the night due to hot flashes and they're waking up and they're sweaty and stuff, that is a big trigger. So to improve lifestyle, right now they're not sleeping, they don't have a connection with their partner. And I believe, after being married and counseling thousands and thousands of couples, sexual intimacy is so key to the maintenance of a healthy, happy marriage and relationship, right? So maintaining that connection is very important. So lifestyle would be good. So to achieve an outcome, lifestyle. And then number three would be is if we have some other type of metabolic problem, like let's for example say type 2 diabetes, right? So if I can take somebody who's got diabetes, they're struggling with their health, their weight, then when if I can get their hormones balanced and get them back in the gym to move, the hormones help them feel better to go do the work necessary to overcome the problems that have contributed to their diabetes and their health issues, at the baseline. So I would say those are the three biggest factors, or that's how I approach it. And those are the three benefits that I'm going to talk to my clients about. And there's data out there. We can go back to 2006 and pull papers 2005 that show that men who are on testosterone have a less likelihood of developing heart disease. Now,
Mm.
it's not as simple as that on the surface, because when you dive into it or when you're the clinician, you notice that there's a sort of like a study bias, if you will, right? Like, so guys on testosterone typically aren't going out to the bar every night and ordering a bunch of drinks and eating bad food. Most men who are going to commit to a testosterone regimen will also commit to multiple other aspects of a healthy lifestyle, including exercise, diet, prioritizing sleep, etc. Right? And so it's not enough to say that testosterone is responsible for the decrease in heart disease. It's simply a placeholder for a better set of behaviors that are possible because of testosterone.
That makes a lot of sense. And is something like that typically discussed in a primary care doctor's office? Because I feel like with the way that things are, with insurance issues and time allotted for appointments, I've never had anyone talk to me about hormones. Is that something that's currently on the patient's plate to bring up?
Yeah, it's on the weekly that I'm told by a potential client who's coming in for an initial evaluation that they went to their primary care doctor and were, their concerns were thought to not be linked to a hormone pattern. And this happens because of two things, or maybe three, whatever you want to say. One was what you said, the time constraint, right? So insurance companies typically don't, because there's not a lot of money in treating hormone replacement therapy. So, from the standpoint of allocating time for the practitioners who work for the insurance company, they don't really want you talking about this because it doesn't result in either a test ordered or a medication. And that's how insurance companies make money, right? Every time you use your insurance, whether it's through a study or a medication, whatever, they get a profit off of that. So there's not really, calling a compounding pharmacy for you to get a progesterone capsule. The insurance company doesn't make squat off of that. So there's a financial and time incentive to make this work. The other part of it is that the the insurance companies and the machine as a whole don't want you and me to have access to these therapies that are going to keep us from being well 2 decades from now. So let's imagine for a second, my office is right across the street from Ascension St. Thomas, the headquarters of the largest nonprofit healthcare agency in the world. Okay. So when you look at that hospital and that conglomerate, imagine that in 10 years from now, 25%, only 25% of the people who currently need joint replacements and heart caths, if that volume was totally taken off of their schedule and their books, their balance books, what do you think would happen to their system? They just lost 25% of their revenue across their entire system. They don't want to lose that. And so, if you can keep people, men and women, healthier by replacing their hormones and decrease their rate of cancer, decrease their risk of osteoporosis and falls and fractures in women, and cognitive decline, if you can reduce all that with hormones, why would an insurance company have an incentive to give you those therapies? They don't, because then you don't need their secrets, their poison. You don't need their garbage anymore. And so, was and another part of this too is that most doctors are trained to look at the lab values, right? We kind of touched on this already, how the labs will be normal. And so most of the time these girls go in, they're like, I feel terrible. This is what's going on. And doctor goes, well, I don't really see anything that's off. It looks pretty normal to me. But reality is that underlying it is that, yes, on the surface, it looks like their numbers are being met, but their body biologically needs more than what their body's providing. And that's when you got to supplement. And so it's just not on the radar of most doctors. Their time, the schedule, their employers, the system in general doesn't allow them to do it. And that's why when I told you, like, I knew this, I knew going into this at 35 years of age that I was going to get some canned story about being depressed. And just think about how many women that you may know in your social circle who at the age of 35, 38, 39, 40, 42 ended up on an antidepressant for mood disturbances that were most likely related to hormone imbalances.
Right, but in accordance with what you were just talking about, it's more profitable for them to put them on an SSRI and send them down the pipeline of talking
Exactly.
to a psychiatrist,
Because now they're coming back every 90 days to get a
right?
refill of their medication.
I'm not super conspiracy minded, but if you were to ask me which one I believe, it's that it's more profitable to keep people sick. And so these longevity sciences, not only are they like not studied as much and not provided to people when they are provided, it's all out of pocket. It's typically not something that's covered and it's not something that's put in the forefront of people's minds to live in a preventative way.
Absolutely. Yeah, that's 100% true. And that's what allows the system to profit. And that's why we have the sickest population in the world, basically. And yet we have very wealthy insurance companies
Yeah, it's a little
and drug
depressing.
companies, right? I mean,
Yeah.
I think Pfizer had a spot at the Super Bowl last year. I'd like to know how much that cost them. So keep in mind that Pfizer's dollars were buttressed through tax dollars for COVID vaccine payments. So I mean, congratulations, your tax dollars went to allow Pfizer to purchase an advertising spot at the Super Bowl.
Yeah, nobody wants that.
Nobody wants that. And I'm so glad that RFK is wanting to take their stupid commercials off TV. It's garbage. I mean, I see a lot of people, and I can tell you that the human, and this is probably not a secret to you because you've probably seen people do this. If you tell somebody something long enough and loud enough and consistent enough, it becomes hard to deny it, right?
Mhm.
And so if you constantly tell people that you're constantly bombarding them with messages that pharmaceuticals are the answer for anything that ails you, guess what they're going to believe? They won't default to lifestyle. They won't default to, some type of more logical approach to their problem. They're just going to go to what the canned answer is, or what their insurance will pay for them to get, which is not usually in the client's best interest. It's in the best interest of the insurance company and pharmaceutical company.
A lot of people know this statistic that it's only us in New Zealand of every country in the world that's even allowed to have pharmaceuticals advertised.
Yeah, if 98% of the,
Mhm.
98% of the world doesn't do something, there's probably a reason why.
Yeah, absolutely. I remember anecdotally just being a kid growing up and seeing commercials because I thought the name of it was so weird, but like restless leg syndrome, I'm like, why do I even know what that is? I shouldn't know what that is. And I know what it is because there were just so many commercials about it.
And just to think about like this whole longevity game, right? I want to break this down real quick for your listeners. To if you're thinking about like I don't want to go to the doctor because something's going on, I want you guys to just think about five things: stress, hormones, exercise, diet, sleep. Start to figure out how you're going to optimize those five areas of your life. If you find yourself scrolling or sitting around watching some binge thing on Netflix or whatever you're doing, eating at some place that's not good for you, then start to recognize that if this behavior is not moving my life in any of these five areas, then I need to abandon or change or supplement something else in place of that behavior. And you will be surprised at how simple that framework, that matrix of working on the sheds, right? It's basically shed: stress, hormones, exercise, diet, and sleep. So if you focus on your shed and how you keep it healthy, then you will be good.
I like that. I love a good acronym. It's easy to remember. So, looking at those tools, I mean, obviously, diet and exercise, but let's look at more of the supplementation areas. Can you talk to me about what are some of the most affordable ways that people can start taking control of their longevity versus on the other spectrum, what are the more expensive things that people can do?
Sure. Basic stuff would be I would invest in electrolytes, like whether that's salt or some type of electrolyte powder with hydration. And I would focus on getting clean water, right? So getting clean water and making sure that you're drinking, 3 liters or 4 liters or whatever, your kind of activity level can demand of you. And then using some electrolytes on a daily. I would I would invest in my space where I sleep. If you sleep hot, consider getting a chili pad. If you need have lights coming in your room, figure out how to make it dark. And I would invest time in my sleep regimen. What does my sleep hygiene look? What am I doing an hour before bed? Do I need to take magnesium? Do I need to take melatonin? Does CBD or THC help me get more sleep? And these are all things that are very low cost, right? We're not talking about anything that's very expensive, and these are the basics, really, right? Um, in terms of like supplements, I think that vitamin D is huge. There are very few supplements that I ask my clients to take on an ongoing basis. Vitamin D with vitamin K2 is one of those supplements. For females, I typically recommend a starting dose of 10,000 units a day. And for males, I recommend a starting dose of 15,000 units a day. And I want to check their levels in about 6 weeks. My ideal range of vitamin D is 100 to 120. I'm happy if we're above 80, but I like to see above 100 if I can get it there. Okay. The other supplement that I believe is good long term is going to be a methylation formula. We have one here that comes from Orthomolecular. You can order it off the internet. It's called Methyl CPG. 70% of us have a breakdown in the genetic makeup of our methylation or detoxification cascade. Most people may not have the bandwidth or money or whatever to go on a journey of doing a genetic analysis and seeing if their genome actually has some breaks in it. So just take the methylation formula, right? Like go get a comprehensive methylation formula. It's a water soluble vitamin. You'll never overdose on it. Whatever your body doesn't need is going to end up in your urine. So, and if you don't have the genetic breakdown, it's not going to hurt you. But if you do have a genetic breakdown in that cascade, this could make you feel so much better, right? um, I would really, especially if you're over 40, start to limit alcohol. Like it just really starts to take a toll on the body. And so I would start to do that. And if you are going to take some alcohol, then consider taking something like N-acetylcysteine or glutathione along with it to help your body kind of clear out the alcohol. Um, the other thing that I think is kind of like a ounce of prevention, pound of cure kind of thing is how you eat. It is so important to focus on finding a diet that is conducive to your body. And I tell people like the diet must do three things. It must be something that you can do both financially and technically, right? So you can't cook complicated meals if you're not a good cook. So you have to be something you can do. That means afford and put together. Number two, it has to be something you can stick with. It has to be palatable for you long term. If you constantly feel or telling yourself you're missing out on this, that, or the other, you won't stick with it. That is actually hardest for my female clients, by the way. Female clients typically enjoy a lot more variety in their diet, whereas my male clients, as a general rule, will be happier or more tolerant of a restricted profile, restricted palate. And number three, for your diet, it has to meet your metabolic demands. It must include enough of your essential fatty acids, your essential amino acids, your protein, your fats, some fiber, pre-fiber stuff. Like there has to be it has to meet the body's demands. And so those are the three boxes that we look to check when we kind of design diet. And we build that galena off of taking a sort of paleo center and sort of making that paleo approach more specific to that individual.
That's so cool. Thank you for that. And I was suppressing a laugh because I have dated so many men who have been able to freeze these really weird, like boring chicken burritos. I'm like, how can you eat this every day? I
And pull
get
them out, right?
so
And
bored.
microwave them. They're great. Yeah. Yeah.
Oh,
Guys
that's
will do
so,
that. It's so simple for
yeah.
guys, you know?
I wonder what that is, like why a woman's palate just can't tolerate like the boredom.
I wish I knew. I don't have the answer to that, but that's just a trend that I for sure can tell you plays out in real life.
So funny. Can you tell me a little bit about, because I don't know anything about it other than hearing that it is a helpful tool for longevity, but what is NAD? How is it administered? How do you know that you need it?
Yeah, these are some of the more, these are sort of the more expensive advanced steps, right? So now that you got some of these baseline things, now you start to look at finding a concierge doctor who's knowledgeable in hormones. And another side note here, you brought this up earlier, and I didn't go back to it, but when you're talking about the conventional medical system, what's going to happen now um, is that the people, the institutions, meaning pharmaceuticals and hospitals and insurance companies that have traditionally kept these life changing and life helping therapies away from you because of what's going on with Make America Healthy Again right now and how we're kind of changing the dynamic. These same people that kept you from getting these things are now going to come and offer them to you, right? Because they will realize that there is a profit to be made. There is a whole host of people out there right now that 6 months ago were peddling poison that are now trying to tell you, no, no, come here. We'll help you with your primary care. We want to do root cause stuff. We really do. Well, why were you not doing root cause stuff 6 months ago? Because it wasn't profitable for you. That's why you didn't do it. So now all of a sudden that the game has changed to where you can make a little money off this, you're going to start to do this. That's the only reason they're in it. They didn't dedicate their time to perfecting a model that actually allows people to win the game. They're just doing it because the money's there, right? So be careful who's selling you wellness, and that applies to everything from doctors and hospitals all the way down to independent practitioners like me. Make sure that the person you're dealing with has been in this game for a while, that they didn't just jump on the peptide train because you can go download some stupid protocol off the internet and set up an account with a pharmaceutical company. So there's a lot of people out there doing that they have no background, no training, but they can hang their shingle out and start doing this because it's popular right now. And so you're right. The popularity of these therapies like NAD and the big ones that we use here are going to be things like ozone, which is a big proponent for a healthy body, and NAD. But NAD, and this goes back to the reason at the sort of molecular level why our hormones decline. A lot of our hormone synthesis is actually occurs in the mitochondria. So I don't know how much you know about the mitochondria, but the mitochondria is a really, really unique organ with inside a cell, right? So I was asking my son the other night because he's a freshman in high school and he was studying biology. And I asked him, I asked him some questions about this, and we were discussing it. But the point is that the mitochondria is unique. And I asked him, I said, how many copies of DNA does a cell have inside of it? And he says, one. And I said, no, that's actually not correct, because the DNA, or mitochondria, has its own genome inside of it, right? So the cell, the nucleus of the cell, has its own specific genome, but then within each mitochondria is a specific set of DNA. So we know that the mitochondria has critical function for sex hormone synthesis and detox. There's a whole energy production. Like, we could go through all the functions of the mitochondria, but it'd take us all day. The point is that when you look at aging, that mitochondria, in my opinion, seems to be one of the centerpieces, if not the centerpiece, of why the body actually ages. It's accumulated damage at the mitochondrial level. Now, think about that, because the mitochondria actually works on electricity. It's a flow of electrons. So it's actually like this electrical little organelle inside a cell that's generating energy. So if things like PMF waves and toxins and stuff can disrupt your cellular energy production, right? And then you accumulate things over time, like other toxic compounds that are going to further compromise the ability of the mitochondria to work. Then what will happen is that the things that are the desired components of the mitochondria, such as NAD, will also decline. And I describe NAD like this decline. So imagine that you had the old, flour mill back in the 1800s, where the wheel would turn, the water would run over it, right, and turn the grist mill. Well, imagine that on that little conveyor belt moving the water down, that there were little buckets holding that water, right? And that in each of those buckets was labeled NAD. Okay. And so your body is producing this NAD that's dumping this water over to turn your energy pump inside your body, right? As you get older, as you get sicker, if you have life events, you got run over by a car, hit by a train, whatever. Now, when your little conveyor belt's coming by, there's so many fewer buckets of NAD on there.
Mm.
So your body's ability to generate energy, to detox, to produce hormones, to do all of its vital functions, specifically at the mitochondrial level, is now compromised. So NAD is a big one, and then NR, nicotinamide riboside, which is a precursor to NAD. Those two things are very important, not only for cellular energy production, cellular detox, maintenance of hormone balance, anti-aging, longevity. It maintains the genome of the cell itself, because NAD is actually present within inside the nucleus. So NAD is not only present within the mitochondria, it's present within the cytoplasm, which is the sort of inner workings of the cell where all the magic happens. And then the nucleus, where the control center of the cell, also has NAD. So NAD affects us in so many ways. I mean, I've seen it reduce cravings of alcohol, caffeine, arthritic pain. So many different things can be helped with NAD.
And it's one of the more expensive therapies, or what's the way that people get a hold of it to where it's actually effective? Because I've seen like supplements on Amazon, but I don't know if I trust that.
Yeah, I think, well, here's what I would do if I there. So I predominantly use NAD in three ways. We use it orally, right? So I use a compound called True Niagen. We happen to be able to get a physician formula, which is 500 milligrams per capsule. I think the over the counter version is 400 milligrams. But taking a daily dose of NAD can be beneficial. Okay. I At one point I was taking up to 2,000 milligrams of NAD as an experiment orally daily, and I can tell you it made a huge difference for me. But the
Mm.
recommended dose is usually around 400 to 500 milligrams a day. The next way that I use NAD is I'm sorry. Go ahead, Glenn.
Oh, I was going to ask if you have to take it with that precursor too.
Well, unfortunately, here's what happens with NR. I know that if you go online and research, you may find a conflicting report about this. And I think the data, I'm not saying that I'm the end all be all here, but here's what I understand is that things like NMN and NR have very short half lives. So once they're packaged, they, like, I know the NR that we have is gone in like 45 days, right? Like, and it's kept cold in a vial, and it's in a powder form. So I think that some of these components don't have very stable shelf forms yet that can actually be can make a tangible difference in the outcome for people, right? So right now, the one that I feel more confident with is kind of like the NR. I'm sorry, the NAD in the oral form. I do use a form of NMN in a compound called senolytic, which has things like pterostilbene, CoQ10, and some NMN in it. I just don't know how potent it is at the end of the day. Um, and so NAD is definitely a very potent thing. And you were asking about cost. I mean, for us here, a regimen of 6 NAD IVs with, and we kind of package this up in what we term a mitochondrial rejuvenation protocol. You can imagine a complicated process like this doesn't just work on one compound, right? Like NAD has other friends that it brings to the party so that it can, it can work better and do its job better. And so those cofactors that are necessary for the cellular function to go forward, we use those in an oral form while a client is getting the intravenous NAD to help improve the effects of the intravenous therapy. And so we're using a combination of 6 oral treatments during that 8 week period to give them the benefit of getting that well rounded mitochondrial rejuvenation plan. And so that's about $3,700 or $3,800 here at our office for that treatment. So, I mean, look, it's expensive, but I mean, in a way, it's expensive. But let's think about it another way. What if we thought about it from the terms of productivity? Because I would have you consider that for the average person who is, especially if you're an entrepreneur or self employed, or you work for yourself or you own your own business, for you to spend $3,000 on a treatment like this, I would bet you dollars to donuts in the 2 to 3 months following this therapy, you will close more deals, you will make better money because you are more present, more focused, more capable after this therapy. And so I would be shocked if you spend, let's just call it 3,000 on my therapy, if you don't go out and make 12,000 because you feel and perform better at your business and your job.
Right, and you're potentially capping the expenses later in life of issues that'll happen from deterioration if you don't put a stop to it.
That's right. Invest in your health now or your sickness later. You get to choose. And I routinely see in guys. I've said this before publicly. It's routine for us to see a guy who will double their income in the 18 to 24 months after starting testosterone therapy. And I'm not saying that testosterone is what does that, right? Like, I use the analogy sometimes of testosterone having like a give a crap cup, right? Imagine when you're young, you have this cup full of give a crap. It helps you get through your day. You can, all the things that require your attention, you get to devote to this supply of give a crap. Well, when you get older and you have more stress, not only do you need more give a crap in your cup, but you don't sleep as well, so your cup doesn't fill up at night. So now when you wake up in the morning at 40 years of old, your give a crap cups like this. Well, fight traffic on the interstate, deal with the kid that's sick, you had to run into the office early, whatever it's probably going. By the time you get to like 2 o'clock in the afternoon, your give a crap's gone. So if you tell me go to the gym, you tell me to eat healthy, you tell me I need to be present for my wife and kids at night, forget that. I'm exhausted. I'm done. And so testosterone helps refill your give a crap cup. And most of the time, what happens is that people use their extra give a crap to do the things that keep them healthy. They don't go belly up to the bar and start eating bonbons. You know what I mean? They go to the gym, they make connection with their kids, they work harder on their business, they close extra deals, they make phone calls to the family that they haven't talked to in a while because they have the mental bandwidth to do these things. And their life universally improves. And so, over the course of that 2 years while they first start testosterone therapy, their connections start to pay off. Now they've taken more sales calls, they're doing more callback on leads, they're taking their family on vacation so they have a more meaningful connection with their loved one. Like, it all starts to play out and it works really well.
I love that analogy so much because it's so easy to visualize it, and everyone I think has been through that experience of just lacking bandwidth, especially as time goes on. Is it ever too late to start these therapies? Like, should you be jumping on it in your late 30s? If you don't learn this stuff until you're, let's say, in your 50s or 60s, is it still effective to jump on it?
Absolutely. Yeah. So first thing is that I do believe that earlier is better. We know that disease starts 20 years or 2 decades or so ahead of the time it manifests, right? So, I've been doing a paleo diet pretty much since like 2011. And, if you look at people who are like my age that I, went to school with or have known for years, and I've made a commitment to be gluten free and, and eat more clean in the last decade and a half, there's a clear difference in how our bodies are aging, when I look at my peers. So committing to a healthy diet, makes a big deal. Uh, and so I know that's a big key. I'm sorry, where were we? What was the question again? Tell me where I got distracted.
Oh, that's okay. If when you're going in and you're starting all these kind of these
When do you do this? Yeah.
therapies, and yeah, is it ever too late?
No. So earlier is better because if you get the treatment earlier, then the deficiencies of the hormones don't start to affect your body. So kind of the data shows, like when I was on Kristen Cavalier's podcast, she asked the question like, does menopause accelerate female aging? And the answer is unequivocally yes, right? Like we know that once that menopause switch is finally flipped and estrogen has now left the building, you've got about 5 to 6 years before bone density really starts to compromise, muscle mass is lost, maybe even neural connections start to suffer because of the lack of those hormones. And so, yes, I believe that starting early is good because the accumulated sort of damages by not having those hormones will show up 20 years from now, right? And so there was actually an interesting study. I'll be glad to share the link with you and you can share it with your audience. But it's really easy to find. If you just go into a search bar on the internet and you type in Journal of Menopause, May 1st, 2024, that's the time that this article was published. That article, and to back up a second, in medicine, we have drawn a lot of arbitrary lines. An example of this is let's say past the age of 65 you no longer need to get a colonoscopy, or past the age of 65 you no longer need to get a mammogram or whatever it may be, right? Or a pap smear or something. So there's all kind of these artificial guidelines that we've sort of put out there. Well, in May 1st, 2024, the Journal of Menopause had an article published in it that looked at 10 million senior Medicare women. So these are women over the age of 65, okay? And now, if your listeners go and look at this, I will caution them because the language is deceitful, and it's intentionally deceitful. Okay, they use terms that are not interchangeable, like progestogens or progestins, which are not progesterone. Okay, so when if your listeners go and look at that data and they look at some of the categories, they can say, well, in this category, breast cancer was actually higher, but that's because it was a synthetic progesterone. It was not a bioidentical progesterone. So don't get confused. My point behind this is that in that study, it supported the use of bioidentical hormone replacement therapy predominantly with estrogen and progesterone only. So there was not testosterone in this, and it showed that there was a reduction in things like AFib, dementia, stroke, heart attack, breast, ovarian, uterine cancer. All of those things seemed to be better. And maybe it wasn't all double digit reductions, but it seemed to be better in the people who were taking bioidentical hormone replacement therapy past
That's good.
65. So now we can
Okay.
say that in the older crowd, there is a reason to start it.
Yeah, absolutely. And as you were saying, all of those lifestyle factors matter too, and it's never too late to start those.
Absolutely. Yeah, those are basically free, right? Like you don't have to do anything to do that, you know?
Yeah, I know that you are really well versed in stem cells, so I would love to hear your opinion on when those are good to consider and why you think that and the FDA here drags their feet and there's all this like kind of anti-stem cell, just like the lack of research and the lack of accepting it as part of our interventions here.
Yeah, I think that yeah, I'm sure you started off said, "Oh, I'm not really a conspiracy theorist," and I would consider myself to not really lean that way either. However, I'm also a what I would consider to be a forever student, so I'm constantly trying to learn and ask questions, even questions that seemingly may have been answered before. And so I have the same conspiracy thoughts about why we don't have stem cells. It's the reason is why we don't do hormone replacement, right? Because it would put people out of business. And look, I think there are several reasons why stem cell therapy still has a bit to go here. Most practitioners are extremely unknowledgeable about what to do. They have no clue about why an MSC is good and how to apply it. And so their knowledge base is not there to meet the demand of the populace. The other part of this is that we are just so entrenched in a corporate medical system that doesn't want these therapies to be available. And don't kid yourself, guys. You don't want insurance in this game. You do not. Please do not think that that's a good thing. It's not going to make it easier for you to get. It's not going to make it more affordable. It's not going to make it more efficacious. It's only going to complicate it if insurance gets involved. And so um, the the likelihood that we will have stem cells available, and when I say stem cells, what I'm referring to is specifically MSCs, mesenchymal stem cells, and whether or not those MSCs have been modified in some way to fit a certain type of injection, like let's say maybe a cartilage injection versus doing an intravenous infusion. So those MSCs can be altered to kind of fit some environmental factors that may make them more effective at what you're trying to achieve. But I think that we've got a couple of the lag is caused because we have a lack of practitioner knowledge, and we have a lack of support from an entrenched medical system that is based off of commercialization of medicine and doctors. Now, when we should consider this, I believe that we should consider this as a first line therapy with pretty much any type of um, ongoing degenerative process within the body. Okay. Now we can break that degenerative process down into a couple of broad categories. One being something like systemic, right? Treating something like organ damage after a heart attack, maybe COPD. People have got lung damage from maybe inhaling dust or what have you. So we can think about systemic organ help, right? Maybe even the brain and nervous system. And then we can think about skeletal, shoulders, hips, knees, shoulders, things like that, elbows, orthopedic injuries, high ankle sprains in athletes and stuff like that. So if we, because the conventional therapy right now is to inject most of those people with steroids when you're talking about some kind of skeletal thing, right? Steroids should be the last thing we're given. We should be injecting umbilical cord matrix. We should be injecting, stem cells. I've got a product called Better Than PRP that works, which is, you can take your own blood, get your plasma out, which is PRP or platelet rich plasma. But I have a synthetic version that's made from the umbilical cord that has the same set of growth factors and cytokines in it that your own PRP does. They're actually at a higher concentration. And I don't have to draw your blood. So I save you a needle stick, and it's actually more affordable. So for somebody who's got a baseline level of arthritis, my preferred treatment is to inject their knees with PRP, usually 2 or 3 times over, 3 months, 4 months, 5 months, something like that. And you would be shocked at how well an arthritic knee can perform with 2 or 3 of these PRP injections. And now you're taking people who would have otherwise had a steroid injection and then a glide path into a knee replacement. Now they're able to have functionality, reduction of their pain, and not have to go under the knife. And yes, they may need to repeat that treatment in 1 or 2 or 3 or 4 years, because the degenerative process in the knee isn't going to stop. It doesn't magically go away just because we arrest it, right? It's kind of like 2 steps forward, 1 step back kind of thing. So from that perspective, I believe that when we start to see any type of ongoing degenerative process in the body, stem cells and these regenerative therapies should be first line. And that includes peptides, by the way.
I mean, that makes so much more sense than to do the dance of constantly getting steroids and then having to deal with all the other complications that might come from that, not to mention doing a surgery. I mean, if we can avoid doing surgery, shouldn't we at all costs?
I agree. And I'm the surgeon who doesn't surgery anymore. You know what I mean? And so I believe that there's a time that we need pharmaceuticals. I believe that there's a time that we need to heal through cold steel, so to speak. That was a surgeon saying is, you got to, sometimes the disease process just requires that type of intervention. And we should be attuned to that. And one of the topics that I know we were going to kind of touch on was this insurance game. And here's where that can come in, right? So just think about this. The average person is probably going to hear this and think, well, I can't afford it. Well, let's wait a minute. Maybe you can. What if everybody played nice in the sandbox together? What if you had an insurance policy that only covered you for things that were done at the hospital? Nothing else. Nothing else was covered. Because think about what your insurance policy covers you for your car. It covers you for basically two things: an accident that lands you up in some kind of auto mechanic shop, right, where you got to get a repair to your car, or when you're involved in an accident and someone suffers injuries, and it will cover you. Those are the only two circumstances that your insurance doesn't pay for: tires, batteries, windshield wipers, maintenance. None of that is covered by. So, what if we allow people to pay an insurance policy that was only $100 a month, so that if they got into a car accident, needed an appendectomy, or had to go in the hospital for something, that they now were able to go get that care, emergent care. But instead, we incentivize them with tax-free dollars that everybody had an HSA that's not tied to insurance. So everybody in this entire country it can take now money from their pre-tax dollars, put it into an HSA account. It never expires. It never goes anywhere. There are no caps on it, and you can put as much money as you want in there. And you don't have to have these stupid mandates from these idiot senators and congressmen to buy insurance policies that don't fit your need. So now you're able to take your discretionary pre-tax dollars, which is going to help lower your overall tax burden. You're going to take this money that you get to be the sort of the custodian of. And if you want to go get stem cells, then go get stem cells. And you can save your money and roll it over so that it actually allows you to pay for these regenerative therapies. That to me is the simplest way to allow people to invest in their own therapy without having insurance dictate it. Now, what happens is that if you need to go to the primary care doctor, you pay a fee up front and it comes out of your HSA. But the insurance company doesn't have anything to do with that. So now you've taken insurance out of the business of making money off of your medications, of making the money off of your x ray, of making the money off of your cardiac echo. They shouldn't get any of that. They shouldn't have any role in administering any of that stuff. That should be between the client and the doctor. If I tell a guy like, "Hey man, you need to go get an echo on your heart. It's going to cost you about $100 to go do that at the cardiologist," then the guy should be able to make that determination of whether or not they want to go through that test, and insurance shouldn't have anything to do with it.
I'm so glad you answered it that way because one of my questions was going to be what's your dream scenario for insurance and how should it be? And is there anywhere that's doing it in a way that you think we should be modeling after?
Uh, I'm not aware of anyone who's doing it that way, but I do believe that that would be the best way, is to allow insurance to only suffer, or I'm sorry, not suffer, serve in the catastrophic situations of cancer, needing hospitalization that lasts, not just a couple of hours kind of thing. And even routine emergency room care should not be covered by your insurance. Why? Because most people use their insurance like they do a primary care provider. Go to your primary care doctor, right? And even, we can show if you go look up data on direct primary care and how having a relationship with that doctor, it's been shown to reduce hospitalizations by 30 to 40%, medication administration by 30 to 40%, overall improve your likelihood of getting a chronic disease by a certain amount of percentage. Like, having a direct relationship with your provider will save you money on every angle of your life.
Yeah, and I wonder if it would drive down the costs of all those things too, because I think a lot of people have had the experience of, oh, you go get an x-ray or you go get something done outside of insurance, and then they bill you the rate that they would bill the insurance company at. You can almost always call them and be like, hey, I'm paying out of pocket, and they'll lower it because they're purposely trying to get more money out of the insurance company. Yeah.
Exactly. Yeah. And so for the listeners out there, right, one of the things that insurance that I would tell you guys to never use your insurance for is some type of diagnostic imaging study. And whether that's an ultrasound, an X-ray, or mammogram, whatever that is. I say mammograms. I probably shouldn't say that because most mammograms are covered for free under insurance. You're paying for it. You're just not paying for it directly. But but let's suppose that, like, when I hurt my shoulder here several months ago and had to have surgery on my shoulder, um, I didn't go to the ER. I knew I'd messed my shoulder up really bad. I just basically got the order sent to the imaging facility to where I paid cash. And I walked in there, and $365 later, I had an MRI of my shoulder, and I was able to walk out the door with it, right? And take the disc with me. So, as a general rule, if you're getting any type of imaging study, I would recommend that you pay cash for it. So you're just probably going to come out better if you do that, whether it's a CAT scan or an MRI or X-ray or ultrasound, whatever. If you pay cash for it, you're probably going to get a better stick.
I wish I had known that a year ago because I went and got a mammogram through insurance and they actually did send me a follow up bill for $1,500.
Yeah, and a mammogram, honey, well, if you pay cash for it, it's probably like $300 or something. You know what I mean? It's really cheap. You know.
Oh,
Yeah,
ridiculous.
and that's the way it should be, you know. And so, I mean, just to kind of touch on this, the reason why this is, and I'm speaking, you know, Texas has got it right. This is one of the things where I can say where somebody's doing it right. And Texas has it right. Texas does not have, or at least their CON process. CON stands for Certificate of Need. And here in Tennessee, it's quite it's quite sad actually, because if you think about it, we have the University of Tennessee Medical School here. We have Vanderbilt Medical School here. We have Meharry Medical College here. And we have East Tennessee State University Medical School. Those are the four that were here when I was going to medical school. So now we have other osteopathic schools that have popped up. But if you look at Nashville as a whole, the unique kind of microcosm that is Nashville, we also have St. Thomas Ascension, the largest nonprofit healthcare center in the world. We have HCA Centennial, which is the largest for profit healthcare center in the world. And it's been said that 85% of all healthcare policy originates in Nashville, because if you look at the tentacles of an organization that is as broad and deep as HCA, where they own things like insurance companies, surgery center management services, and companies that manage surgery centers and own surgery centers, all of these aspects of healthcare are kind of under and influenced by HCA and all these big companies here in Nashville. And so the health policy that comes out of here is actually pretty interesting. And so what they've done is they've managed here in Tennessee to have what's called a certificate of need process, or a CON process, that's very difficult. So if I as a doctor wanted to get an MRI, right, and basically charge everybody like $350 for an MRI, I can't do that, because I have to, by state law, compete against Vanderbilt, St. Thomas, and all these other big hospitals and imaging centers, because they want me to have to go through an expensive, laborious process to prove that the community needs this MRI scanner. And now I've got to spend upwards of $300,000 in lawyers and months and months and months of fighting these regulations to finally get a CON, and then I can go buy my MRI machine and get it installed. And you know, that's an anti-competition thing. That's not fair. That's not right. And in Texas, a doctor can start up an imaging center. They can start up an urgent care without having to prove need. And that's another thing that insurance needs to get out of. But we got to have politicians. These politicians are so weak, Galena. I'm telling you, they're like a tree. They just blow this way one day and blow that way the next day, and it's so sad to see. And they have no ties to actually understanding the lives of the people that they have been entrusted with trying to protect. If they did, they would just tell them, Vanderbilt and them, like, oh, we're doing away with the certificate of need process, thank you, goodbye, you know, we're done. I mean, they could do that with a stroke of a pen. And here in Tennessee, we got this weak governor, Bill Lee. You know, he's kind of a he ain't kind of he is a rhino. You know, and he just doesn't stand up to these big insurance companies. He doesn't stand up to anybody, but that's let alone them. You know.
Yeah, I don't know that we have a lot of standing up to insurance companies happening here anyway. And if we did, I don't think that there would have been the public reaction to the United Healthcare CEO thing. Like that was such a wake-up call. And in hindsight, I don't think that anything's been done to improve things since that happened. And I also think that it's probably gotten worse. I mean, I've heard about United Healthcare like cutting even more stuff after that. They don't care.
Yeah, I mean that's their game, right? I mean, how else are they going to make money unless they're cutting services to people? I mean, when you anybody that runs a business knows there's only a limited number of ways that you can increase your revenue. You either increase your cost of your services, or you cut your costs on your back end, like you fire people or you decrease salaries, right? Or you increase the number of customers that you're making. There's only a limited or serving. There's only a limited number of ways to make more money.
Yeah, absolutely. Just a final question on the stem cells. Since they're not really doing it here, are there places like, do you have experience with other countries, or where do you recommend people go if they know that that's going to be an effective treatment for them?
Yeah. So two things. One is that here in the U.S., it is allowable for you to expand your own autologous stem cells, right? So one of the services that I offer is to take about a teaspoon or so of fat. I can send that off to a lab. I can expand your own stem cells, and I can use those. Now, in my opinion, that is not as good as getting youthful, healthy umbilical cord cells, right, from a 9-month born baby, right? So or having those types of cells expanded and then utilized after that, right? And so in the U.S., you do have an option to go and get your own stem cells, and I think that is a good plan for a lot of people that don't want to travel, that maybe don't have the money to pay the extra 10 or so $1,000 that going overseas would require, but still want to be healthy and would rather utilize regenerative therapies over conventional medicine, steroids, and stuff like that. So, and that process is relatively simple to do. It does cost around $20,000 to $25,000 depending on how many cells we're trying to get. But that process can be done here in the U.S. now. Now, if you want to get a more potent treatment, you want to get a more comprehensive treatment, then you will seek out a center that has umbilical cord derived cells that are expanded and sometimes even manipulated in a positive way to make them more effective once they're injected. Okay. Now, I briefly mentioned that I had shoulder surgery. I had that back in April. And in July, because I can't harvest my own stem cells, right, and inject them into myself, I actually went down to what I would consider to be the premier place to go get stem cells, which is the Cellular Performance Institute in Tijuana, Mexico. And I happen to know the owners of that facility, and I understand their dedication to quality and to achieving the best product that they can do. And knowing what they are committed to, and knowing what I needed, I made the decision to go and have both of my shoulders and my neck and receive an intravenous infusion of those stem cells from there. Okay. So if I were asked where to go outside of the US, I would say Cellular Performance Institute in Tijuana, Mexico. And I say that after having been a client there just a couple of months ago. And I'm a proceduralist, right? Like I'm a doctor that worked in the operating room, and that was my whole job, was to do procedures for a living. And I can tell you that their clinicians and that their staff are the best trained, best qualified people that I've ever been around. You know what I mean? They're no different than the top level of care that you would expect at the best center here in the US. Um, Food was great. My outcome has been fantastic. So on one hand, if you're that person who says I don't really want to travel, I'd rather stay in the US, and while there may be a premier treatment for me, I'd rather do my autologous stem cells. That's available for them. If we're looking at going outside, I would recommend CPI.
Amazing. Thank you. Is there anything that you want people to take away from this that I haven't asked?
Absolutely. There would be, if I could say one thing to the listeners, it would be um, to, on the, on your average daily life, throughout your average daily life, start to focus on how you can improve your life by looking at your stress, your hormones, exercise, diet, and sleep. If you can make positive gains in any of those five areas, you will move your health in the right direction. And then I guess, for a follow up of that, is be careful or be wary of anyone who is kind of not, I don't know, I can't say new to the longevity game, but who seems gimmicky, salesy, or overly pushy, trying to get you to buy therapy or to take a therapy. Um, you can always take your time, ask more questions, and come back to the table again another day. You don't feel rushed to make a decision.
Amazing. Well, thank you so much for that, Dr. Lee Howard. If people want to work with you or learn more about what you're doing, where should they go?
So our website is compasshp.com, compasshumanperformance.com. You can find out a lot about us on our website. We're going to have an updated website here pretty soon. We are located here in Nashville, Tennessee. So you're welcome to call our office. That number's on our website. And we also have our social. So I'm at Dr. Lee Howard on Instagram and on Facebook as Lee Howard. And then we have our company pages at Compass Human Performance. So you can look for useful content there. I put out posts a few times a week, usually talking about the prevailing issues of the day or what I've seen today or what I'm kind of dealing with. And so, yeah, we can interact there. And Yeah, if there's ever any questions, I have a great team of clinical coordinators that are trained to start people through this process. So there are certain types of clients that we need to have an ongoing relationship with, but we also have longevity and anti-aging protocols where people don't actually have to become my patient, but they can use the benefits of our center to come in and get anti-aging and longevity treatments without having to have an ongoing relationship with me as their physician.
Very cool. Well, thank you so much for doing the show today. I really got a lot out of this.
Likewise, I appreciate you having me. I hope this was valuable to your viewers, and I hope that this helped them, in some way to move their health forward.
Me too. Well, thank you so much for doing the show, and thank you everybody for listening. Bye.